Anxiety disorders. Anxiety disorders are a group of mental health conditions where a person experiences excessive worry, fear, or nervousness. It's normal to feel anxious occasionally, like before a test or a job interview. But anxiety disorders cause intense, prolonged anxiety that affects daily life. Common types include generalized anxiety disorder, constant, uncontrollable worry about everyday things; panic disorder, sudden, repeated panic attacks with intense fear and physical symptoms like chest pain; social anxiety disorder, fear of social situations, worrying about being judged or embarrassed; phobias, intense fear of specific things like heights, spiders, or flying. Anxiety disorders can cause physical symptoms like sweating, trembling, or dizziness, but they can be managed with therapy, medication, or relaxation techniques. Mood disorders. Mood disorders are mental health conditions that primarily affect a person's emotional state. People with mood disorders experience intense and persistent feelings of sadness, extreme mood swings, or both, which interfere with daily life. Common mood disorders include major depressive disorder, a prolonged period of deep sadness, hopelessness, and a lack of energy or interest in life; bipolar disorder, alternating periods of depression, feeling very low, and mania, feeling extremely energetic or overly happy; dysthymia, persistent depressive disorder, a chronic, less severe form of depression, lasting for years. Mood disorders can affect relationships, work, and overall well-being, but treatment options such as therapy, medications, and lifestyle changes can help manage symptoms and improve quality of life. Obsessive-compulsive and related disorders. Obsessive-compulsive and related disorders are mental health conditions where a person expresses unwanted, repetitive thoughts, obsessions, and feels driven to perform certain actions, compulsions, to reduce the anxiety caused by those thoughts. For example, oppressive-compulsive disorder, OCD. A person might obsess about germs and feel they need to wash their hands repeatedly. Body dysmorphic disorder. Excessive worry about flaws in appearance that others might not even notice. Hoarding disorder. Difficulty getting rid of items, even if they have no real value, leading to cluttered living spaces. These conditions can take up a lot of time and cause distress, but with the right therapy and sometimes medication, they can be managed effectively. Trauma and stressor-related disorders. Trauma and stressor-related disorders are mental health conditions triggered by experiencing or witnessing stressful or traumatic events. These events can include accidents, natural disasters, abuse, or the loss of a loved one. Common types include post-traumatic stress disorder, PTSD. After a traumatic event, a person may experience flashbacks, nightmares, and severe anxiety, feeling like they are reliving the trauma. Acute stress disorder. Similar to PTSD, but symptoms occur right after the trauma and last for a shorter period. Adjustment disorders. Emotional or behavioral responses to a stressful life event, such as a divorce or job loss, causing significant distress. These disorders can impact daily life, but are treatable with therapy, support, and sometimes medication. Dissociative disorders. Dissociative disorders are mental health conditions where a person feels disconnected from their thoughts, memories, surroundings, or identity. This happens as a way to cope with trauma or stress. It's like your mind switches off to protect you from overwhelming emotions. An example is dissociative identity disorder, DID, where a person has two or more distinct identities or personalities that control their behavior at different times. To manage dissociative disorders, treatment often involves therapy, such as cognitive behavioral therapy, CBT, or trauma-focused therapy helps understand and process traumatic memories. Medication may be prescribed to help with symptoms like depression or anxiety. Grounding techniques. Focusing on the present, like breathing exercises, can help stay connected to reality. Somatic symptom and related disorders. Somatic symptom and related disorders are conditions where a person experiences physical symptoms, like pain or fatigue, that can't be fully explained by a medical condition. The person is genuinely distressed and focuses on these symptoms, often believing something is seriously wrong. An example is somatic symptom disorder, where someone may have recurring pain or weakness, but medical tests show no cause. The distress over the symptoms affects daily life. To manage it. Therapy. Cognitive behavioral therapy, CBT, helps change negative thinking patterns about the symptoms. Stress management. Relaxation techniques like meditation or breathing exercises can help reduce focus on symptoms. Medication. Antidepressants may be used if anxiety or depression are also present. Feeding and eating disorders. Feeding and eating disorders are mental health conditions where people have unhealthy relationships with food, body image, and eating habits. These disorders affect both physical health and emotional well-being. An example is anorexia nervosa, where a person restricts food intake because of an intense fear of gaining weight, even if they are underweight. They may see themselves as overweight despite being dangerously thin. To manage it. Therapy. Cognitive behavioral therapy, CBT, can help change distorted thoughts about food and body image. Nutritional counseling. A dietitian can help develop healthy eating patterns. Medical care. Regular checkups ensure physical health is monitored. Support groups. Sharing experiences with others can provide encouragement and understanding. Neurodevelopment disorders. Neurodevelopment disorders are conditions that affect brain development, leading to difficulties with learning, behavior, or social skills. These disorders typically appear in early childhood and can impact daily functioning. An example is autism spectrum disorder, ASD, where a person may struggle with communication, social interaction, and have repetitive behaviors. They might also be sensitive to sounds or lights. To manage it. Therapy. Behavioral therapies, like applied behavior analysis, ABA, can improve communication and social skills. Educational support. Individualized learning plans help cater to a child's specific needs. Routine and structure. Providing a predictable daily routine can reduce anxiety. Family support. Training for parents and caregivers helps in understanding and supporting the child's needs. Personality disorders. Personality disorders are mental health conditions where a person has long-term patterns of unhealthy thinking, feeling, and behaving. These patterns differ from what society expects and causes problems in relationships and daily life. An example is borderline personality disorder, BPD, where a person may experience intense emotions, fear of abandonment, unstable relationships, and impulsive behavior. They often have difficulty managing their feelings and may struggle with self-identity. To manage it. Therapy. Dialectical behavior therapy, DBT, helps people regulate emotions, improve relationships, and cope with stress. Medication. Antidepressants or mood stabilizers may help with mood swings. Self-care. Practicing mindfulness and relaxation techniques can improve emotional control. Support system. Building a network of understanding friends or family is crucial. Schizophrenia spectrum and other psychotic disorders. Schizophrenia spectrum and other psychotic disorders are mental health conditions that affect a person's thoughts, perceptions, and behaviors. People may lose touch with reality, making it hard to know what's real and what isn't. An example is schizophrenia, where a person might experience hallucinations, seeing or hearing things that aren't there, delusions, strong, false beliefs, and disorganized thinking. They may struggle with daily tasks, relationships, and emotions. To manage it, medication. Antipsychotic drugs can help reduce hallucinations and delusions. Therapy. Cognitive behavioral therapy, CBT, helps manage symptoms and improve daily functioning. Support. Family therapy and support groups can provide emotional support. Routine. A structured daily routine helps maintain stability and reduce stress. Substance-related and addictive disorders. Substance-related and addictive disorders involve the excessive use of alcohol, drugs, or other substances that lead to harmful consequences. People with these disorders often struggle to control their use, despite negative effects on their health, relationships, or work. An example is alcohol use disorder, where a person may drink large amounts of alcohol regularly, experience cravings, and find it difficult to stop, even if it causes problems in their life. To manage it. Therapy. Cognitive behavioral therapy, CBT, helps change harmful thought patterns and behaviors related to substance use. Support groups. Programs like Alcoholics Anonymous, AA, provide peer support. Medication. Certain medications can reduce cravings or the effects of substances. Healthy habits. Developing positive routines and avoiding triggers can prevent relapse. Neurocognitive disorders. Neurocognitive disorders are conditions that affect memory, thinking, and reasoning skills, often due to brain damage or disease. These disorders typically appear later in life and can worsen over time, impacting a person's ability to function independently. An example is Alzheimer's disease, where a person gradually loses memory, struggles with daily tasks, and may experience confusion and mood changes. It is the most common cause of dementia. To manage it. Medication. Some drugs can slow down memory loss in the early stages. Cognitive activities. Mental exercises, like puzzles, can help maintain brain function. Routine. Keeping a structured daily routine reduces confusion and anxiety. Support. Family involvement and caregiving support are crucial for managing daily needs.